Welcome to the HCMS Legislative Podcast, Clean Bill of Health. We want to remind you to join us on August 26th for the Young Physicians Virtual Mentorship Symposium. Connect with seasoned physicians who've conquered challenges you might face in your practice. And mark your calendars for September 23rd. The HCMS Business Expo is here exclusively for you. Earn ethics CMEs and access over 50 companies catering to your needs. Secure your spot for these transformative events. Visit HCMS website today at www.hcms.org for more details. Don't miss out.
Welcome to Clean Bill of Health, Harris County Medical Society's legislative podcast, where we dive into the legislative challenges facing the medical community. I'm your host, Dr. Mina Sinakori, the president of Harris County Medical Society. Today, we celebrate the power of unity and advocacy as we discuss the impact of teamwork in shaping healthcare policies. Join us as we take a comprehensive look at the recent outcomes of the 88th Texas Legislature. The Texas Medical Association and county medical societies entered the legislative session with a clear agenda of bills we wanted to pass, but the session quickly turned into a defensive struggle to protect healthcare and physicians' role in it. The medical community fought against harmful bills that threatened access to care and physician autonomy. It's a testament to the dedication of physicians across the state and from all specialties that were able to safeguard the well-being of all Texans. Let's start with some of the significant wins we were able to secure. First, let's look at the budget, which is the only bill the legislature is constitutionally required to pass. Lawmakers approved long-awaited increases in Medicaid payments, providing a 6% boost to payment rates for physicians treating children and young people, as well as a 6% bump for labor and delivery services. Additionally, the budget expands access to care, fully funds our goal of a 1.1 to 1 ratio for GME, graduate medical education slots, and increases funding for a variety of GME programs. It also provided for telemedicine expansion and improves broadband access for enhanced healthcare services. Thanks to a record budget surplus, public health services also received a tremendous boost. Medicaid postpartum coverage will be extended from 2 months to 1 year, making it a monumental victory for Texas mothers. The substantial $2.3 billion funding increase for mental health services, substance use disorder treatment, and community mental health programs rewards the work that the TMA and HCMS have put in to convince lawmakers to prioritize the well-being and mental health of our population. Next, let's turn our attention to another issue we have worked on for several years, reining in health plan abuses. Over the past few years, we have introduced the legislature to get the concept of prior authorization and its misuses by the health plans. This session, we continued our success with bills like House Bill 755, which will restrict insurers from misusing prior authorizations for patients with autoimmune conditions. Additionally, patient and physician protections were reinforced through bills prohibiting insurers from requiring physicians to purchase drugs through the health plan's specialty pharmacy and banning the plan's practice of pocketing drug manufacturers' coupons and refusing to apply those discounts to the patient's deductibles. These reforms ensure patients receive the care they need without unnecessary financial burdens. All these successful efforts were not without their costs, as our opponents tried to distract us from our goals by attacking medicine from all sides. Protecting against scope of practice expansion was a top priority for the TMA, and it proved to be a daunting task. The medical community successfully halted over 130 scope-related bills from an array of non-physician practitioners, ensuring that physicians remain at the helm of the healthcare team. Our most notable success was the defeat of a bill which aimed to enable APRNs to practice independently. This bill was authored by the chair of the committee to which the bill was assigned, and we kept it from even having a hearing. Our efforts sent a powerful message to the rest of the legislature about the importance of physician leadership. Physicians had to unite to guard their autonomy in the clinic and their liability protections from a variety of attacks. We effectively stopped SB 177, which would have restricted physicians' ability to communicate with our patients regarding COVID vaccines. Additionally, we foiled health plans' efforts to allow them to set our cash payment rates. Finally, the preservation of our medical malpractice tort reforms highlighted the continued dedication to patient access and high-quality care. The recent Texas legislative session demonstrated the strength and impact of the medical community. Despite facing defensive struggles, the medical community secured significant victories in the budget, public health, insurance reforms, and more. Our success lies in the shared advocacy, dedication, and the understanding that we are stronger together. Thank you so much for joining us on this episode of Clean Bill of Health.